Good afternoon. The Ascension Parish Mental Health and Addictive Disorder Advisory Board is now in session. Roll call, Mr. Bryan is on his way here. He's coming from Lafayette. He might not make it. Number 2 is to approve the minutes for the September and the October meeting. Some of the board members still have not received their minutes, and so we're going to have to, unless y'all want to look over them right now, the minutes. You don't have a copy to look over?
I don't have a copy.
And you don't have a copy either? Okay.
I don't know. They must have just got this today. I see a package is over here on the counter with our name on it, but what's the resources, I don't know, because we haven't had a chance to really look over it or read over it.
The minutes of the September 27th and October 18th minutes were emailed along with y'all meeting notice and the agenda.
Well, I did not receive any of that information on my computer. I don't know if the computer was out, down, or what. Brian did
last week.
Huh?
Brian did, you said?
He did get it, and he forwarded it to me last night about midnight, so I know the rest of them didn't get it. I don't know what happened, but we did not receive that package from you.
Okay. Well,
and we didn't get anything.
Try to send that out tomorrow again, and then confirm that y'all did receive it.
Okay, but well, I got it now, and I emailed it to the ones that had it, but Miss Zenobia doesn't have an email, so she hasn't been able to see any.
I received mine on the email, but I didn't print it out to bring it with me here.
Okay.
Okay. So I don't want to get you to understand that I did receive it, and I read over it, but I didn't make a copy to bring with me.
Okay, I read the minutes. They're very good, but I guess before we can have them approved, y'all have to read them, so we will put that on next month's agenda.
And I've always received mine in the mail.
I know you don't have an email, so they have to mail it.
I've always gotten it in the mail, so I didn't get anything in the mail.
Last month you didn't get it either. 2/3. Anything on 2/3? Public comment. I think these are going to speak. Okay. No public comment. 2/3 public comment.
They have public comment, don't they?
We have 3 individuals.
Were they going to speak on Susan's personnel? Don't they have to wait?
Right, but you still have 3 individuals that want to speak. You just need to recognize them.
And let them speak now?
That's
Okay, it's fine with me. I just thought they had to speak wherever they were on the agenda. Well, why don't we just be courteous and let the parish president...
Parish president's here.
Mr. Parish President?
And just move them down to personnel.
Yeah, they sound in personnel, so...
Thank you, Madam Chair.
Good afternoon.
Members of the board. The administration has been going through the needs assessment and the chief administrative officer, and I've read most of it myself, and we're very interested in seeing a lot of this implemented. And I've recently met with the chairman of the hospital service district, the East Ascension district, and she told me that there were some concerns in reference to some monies they have available that they're very interested in using in mental health and substance abuse type programs, and they're meeting with the Caldera Human Services District now. And so I want to try to get this resolved so that these monies obviously can stay within our parish. In addition, as you know, the Chief Administrative Officer primarily has been reviewing the mental health agency and interviewing people, and all the people, those that we could find who had been there and those who are still working there. And I think that has made some significant improvements in working relationships, hopefully. But it's been brought to my attention that some of the things that are in the budget that we did last year that were put in for maintenance and all in the building have become some concerns with some of you for spending some of this money to paint and things. I just want to remind all of you your capacity is advisory capacity. Once the budget's approved by the parish president and the council, I submit it to them, they approve it. That money in the budget can be spent the way it has been budgeted, without the approval of the board. Now, if there's any different amendments that need to be made to the
Mr.
mental
Parish
health.
President, I don't intend to be rude, but you was going to speak on the needs program, not on the budget.
The needs assessment.
Yes, sir.
And part of the needs,
Is to paint the building?
yes, definitely, if that's what's needed, and it's been put in the budget. So just remind you that as an advisory board, you're not a governing board, and we need to get that distinction made and work with Dr. Mittenoff and her staff in that regard. Now,
Well, Mr. Parish President, on that we are an advisory board, do we or do we not held responsible for the mental health funds?
ultimately, the parish council is held responsible for all funds.
The parish council is held
because they are the
responsible.
governing authority of the parish.
Thank you.
They're the only ones who can approve the budget. Our charter, the parish president or the executive branch, submits the budget. And your role as an advisory board is to work with the mental health director in preparing that portion of the parish budget that pertains to mental health. However, once that is done and that budget has been approved by both the council, well, then that money is free to be spent within those budget parameters. Now, if there's a need that comes up during the year that's not within that budget that the governing authority has approved, well, then that process needs to start over. And you recall our charter, all boards report to the parish president once the parish council appoints them.
Well, Mr.
And
Parish President,
so if there's some, excuse me, Ms. Coach, I'm trying to answer all your questions. So if there's a need that comes up that's not in the budget, for example, for 2007, well, then that request needs to be submitted, and you can have input as advisory board with the director of the agency. That needs to be submitted to the parish president, who then my office and the chief financial officer would submit a budget amendment to the parish council to amend the budget that has already been approved previously. And so I just wanted to come to kind of discuss a lot of this stuff because it seems to be a lot of confusion and contention at times.
President, I have a question. You're saying dealing with the director as far as the budget is concerned. According to our ordinance that we follow through legal, that legal approved for us to follow, okay, is not being followed correctly, okay? And
what
that's one of the
Mr. Butler?
The aspect I have, for instance, I'm going to give you an example. If we don't know about anything to approve, and we approve it, for instance, like you say, painting of a building, if she take it to you and the council and say, look, she need this passed, well, when it comes to the board and we deny, we don't know anything about it till after the fact. So a lot of things been done beforehand, before the meeting is concerned. And if we follow that ordinance the way it's supposed to be followed, she's violating the laws and she's violating the rules of, as far as a director is concerned and as far as this board is concerned. We are only protecting fundings, and we're protecting and doing the correct way.
I respectfully disagree in this aspect.
But
once the budget process is completed, okay, and this is according to our home rule charter, the parish president has to submit the budget to the council 75 days before the end of the fiscal year. Your input in that process for the mental health portion has to take place prior to that time. Once we submit that budget to the governing authority, they either approve it or amend it, and they have to do so within 30 days prior to the end of the fiscal year.
I understand all of
Now,
that.
once they did that last year, December 1st, they approved the 2007 budget. Whatever's in that budget is okay to be spent for what those allocations were for.
But it does
Okay.
not have to be spent.
But we understand that. We understand the
It doesn't
budget
have to be
process.
spent, but it wouldn't have been allowed to be in there. I hope you guys wouldn't have been in there unless it was something that needed to be spent. We have a responsibility to use.
Well, to be honest with you, what's the need to have a board then? If everything comes, as far as
It's a great
bringing it to
question.
you and
glad
this,
you
that,
asked
and the
that
other.
question.
But my suggestion is that follow the ordinance the way it's written. Okay,
Yeah.
and if you want things to be approved, it's a proper channel in order to get it approved.
And that
On
that,
any aspect
you
that
guys,
terminology is
as an advisory
concerned.
board would have approved that part of the budget last year prior to October 15th or 16th, whenever 75 days prior to December 31st fell. That's when you're involved in that process. And we usually begin the budget process about 6 months before the end of the year. So in July, we begin the process of preparing the next fiscal year budget for parish government. And so that's when you, as an advisory board, or any other board in the parish, would be involved with whatever agency they're working at, being a waterway commission or a fire district, recreation advisory board, or whatever board is there. You would be involved with that agency at that time to assess the needs for next year and to include in that budget proposal that's sent to me, which I will then send to the council to be approved.
So what happens when you violate the ordinance? As far as the director is concerned, what happens? Something has to be happening. Who is responsible? If you hired
Ultimately,
a
the
director, hold on, let me
governing
finish. If
authority
you hired a particular person to do a particular job, they're responsible. If they break a rule or in violation of that rule, something needs to be done. Okay? And we are following the ordinance. We're going exactly the way it's written. It's been illegal. It's been here. It's been there. They tried to. When I first came on, they had a problem with the ordinance, and when I read the ordinance, I believe in following the ordinance. And the way the ordinance is written, she cannot do anything unless it's an emergency without the approval of the board. Then it goes to you.
No, sir, that's not correct.
Well, that's the way the ordinance say.
You're reading a different ordinance or an old one then.
No, I'm reading the ordinance that was
Once
given
the
to
budget
me.
has been approved and the money is spent according to that budget ordinance. Our budget is passed by the council by ordinance. I can't even deviate from that without the council amending that budget. Okay? And so that's what I said. If something comes up during the year, once your budget year is begun, that needs to be addressed, that requires a budget amendment. And all the advisory board can do is recommend or give advice to
But my
whatever
question
agency they're working with.
still haven't been answered. What happens when you violate the ordinance?
I'm not aware of anybody violating the budget ordinance or the budget process.
Y'all can give up.
I mean, we can go back and forth. We're not getting nowhere with that, but
Mr. President,
Yes, ma'am.
I visited your office sometimes back, and you complimented this board, the members on the board. And we do kind of realize that it's not particularly the members on this board that's your concern, it's the board in general, not to even have a board. But we have followed what was given us to follow. We have reported to you things that we needed to report. And there's still, we were waiting for you to call us in and maybe meet with us like you're doing now. But it's just that it's on public television, and there are some things we'd like to discuss with you in private. But you never, when we contacted you about it, we never got a response from you.
It's easy to make an appointment with me, Ms. Baptiste, just like last time.
We did, and we never got a response from you.
and I never
We're
met with
expecting you to come tonight
All you got to do is call and make an
with the
appointment.
needs assessment, your report or information on the needs assessment.
Yes, we have read through that, and we are working on that, and met with you direct on that, and hopefully all of you have read through it and made comments on it.
Okay,
Now, I haven't received any comments from any of you on it, but if you have comments on it, we need to receive those.
No, we're here to hear your report.
Well,
at this time.
we'll report that we're working on that needs assessment, but we're waiting to hear from them. The thing that we envisioned when we modified this ordinance in '04, that the advisory board will become primarily an assessment tool in the community to assess the needs throughout our parish. And we've had many needs from people who have reached the point of no return of committing suicide. Not only now do we deal with the issue of substance abuse with alcohol, we deal with it with gambling, and as we've allowed
are you aware that we've already done that? We just had a needs assessment done,
We've had two done in the last 2 or 3 years, it looks like.
but the last one we just had done.
Right, and had another one done before that. But we're wanting to work with you to implement this. to make positive change in our community, not
Okay,
to just
as-
keep studying and doing assessments. So
Okay, so your suggestions to us tonight, I'd like
is
to
that
write
the
them
board
down.
recommends what parts of those needs assessments do you think we need to work on immediately, and what are we going to do about it? And we've already, we just about finished the budget process for 08 now. If the council approves the parish budget tonight, well, then our budget for 08 has been approved. And so if there's anything in that needs assessment that's going to be outside the scope of this budget, that's going to require an amendment for the even 08 budget before we, assuming that the council approves that tonight, or they amend it.
That's,
And so,
And-
obviously, most things in that needs assessment is going to cost some money to implement and to address.
have grants?
Well,
That we don't have.
whatever they are, it's still going to cost money.
We
Let's
are,
separate where the money comes from just going to cost some money. So,
We
and even
are-
if we get grants, we still have to include that in the parish
Right.
budget.
Well,
we
we've
are
told.
aware of all of that, and we've done all those things, and we thank you for your compliments that you gave us when we talked to you about it. So the point is, where do you want to go with this? We have a director that refused to do the needs assessment. Therefore, we had to do it. We gave a report to you on a lot of issues. So we don't want to hold up anything. We just want to go forward because of the because
Work
of
with
the
the
people,
director
because
and
of
turn
the
it
public.
in to us what you recommend. We try to implement within that needs assessment based on priority. We can't do it all. What's the most important? What's second important? What's the cost going to be? And if that's outside the budget that the mental health agency has already submitted for 08, then we have to address that from a budget standpoint. Now, if that's already within the budget and the council approves that budget as submitted, well, then we're fine.
President,
Yes, sir.
how could we as a board work with someone that's going against us? Okay? And my question for saying that is that we've been doing this needs assessment for almost 6 months now, okay? And if I ask her right now how many grants we applied for to try and help fund these needs assessments, last month meeting she told me none. So if you're going against the board as far as the need assessment is concerned, when we started the needs assessment, her and a grant writer or whoever write the grants in the mental health department should have jumped on that right away, find out how can we get funds to make this needs assessment work. We're going to make it work with or without her. Okay? But my thing is, how could you work with someone that doesn't want to work with you? It takes more than one person effort. Okay?
It
And
takes-
everything we bring to the table, to me it's like if she don't come up with it, or if it ain't her idea, it ain't gonna work. Okay, that's my opinion.
Well,
I mean,
You have to address that.
but I did it last month. I asked last meeting. I asked her. I
Keep
said, how
working
many
on it.
is the grants? Is the grants there? The grants are there. I mean, I can write a grant. The grants are there. Okay. I asked her personally, who write the grants? Do she write the grants, or is Jill the grant writer, or whoever it is? Okay. She said, I do. I said, well, how many grants have you applied for this needs assessment that we're trying to get going? She told me none.
Well, it's my understanding we have not prioritized within that need assessment yet what we're going to try to do. No,
But still,
we have a grants office within the parish government that's there to help
I
all
understand that.
departments and all agencies. But we just don't go after all these thousands of grants.
But I
We
understand
first
that, President,
decide-
but she's not doing none.
Well,
She haven't did none.
We first decide what are the priorities going to be.
Can
and
we
we're going
move
to say
on?
in this area, this is what we're
And
going to
behind the
work
kind
on.
of money she make, she ought to be doing something instead of trying to trap the board with everything. You know,
Okay.
I mean that don't make no sense. It just don't. She's spending more time directing and pointing the finger at the board than doing a job. I mean that's my opinion. I'm sorry.
Let's move on. Thank you.
So once you guys in the mental health agency decide we're going to do these three things, these are the priorities from this needs assessment,
Mr. Hughes,
and you can't do it all, then we would identify resources, financial and otherwise, and just say one of those priorities from the needs assessment is teenage alcohol, teenage drinking, underage drinking by our young people. But then we would go look, working with the mental health agency and the grants office, for funding sources within that area, be it the state, federal, and Many times you've got nonprofit foundations that are available in those areas. But just to say we're going to take the needs assessment and go shotgun all of this, no, that's not the right way to do it.
Mr. Parish President, excuse me, Mr. Parish President.
Yes, ma'am.
We set up a meeting that the 5 of us was going to get together and discuss how to start this, and we were told that we cannot meet but 2 of us at a time. Well, 2 can't make this kind of a decision. We need the whole board's input on which 3 programs that you suggest that we wanted to start and do. And I set it up, and legal advised me not to have that meeting last Tuesday. So I called it off. And we have to find out a way that we can have a working meeting that is legal.
You can have a working meeting that's legal if it's an educational meeting or training meeting and you're not making decisions.
No
and
votes.
as advisory board, you're just making recommendations anyway. Now, if you want to be quote-unquote ultra safe, you as the chairman meet with 1, then another group of 2.
That's my
But
point.
that's the problem with government because of the Sunshine Act, Sunshine laws, trying to do things in the open. We all have. And I understand your point, Talia, because it's a challenge for the council and for me as parish president sometimes. But you can't have the whole group together in a social setting or an educational setting. You cannot make decisions in governance in those sessions. So, but you can talk about things, and you come back in the meeting.
I read the Sunshine Law, and we could meet, but 3 of us happened to meet up in Donaldsonville, and Jeff and the director reported us for having an illegal meeting to Jeff Diaz, and we got.
And somebody lost their job behind it.
Yeah. So I don't want to take any chances with anybody's job, anybody's reputation, or anything else. But I would like a working meeting for this board to sit down, discuss the the needs assessment, pick out 3 programs, get started on getting them started.
It's my understanding that you as a board could take this needs assessment and you have to to follow your attorney's advice, okay? But you could go through and study it. Now, first of all, you need to study it individually. I recommend and come together with your ideas.
Well, I've read it from front to back several times and picked out what I would like to do. But what I like to do is not for the whole board. Each one has a right to his own opinion on it. And I can't go one-on-one here and then say, oh, no, she said this, unless we take a big tape recorder and sit down with one and then play that and sit down with the next one and play it and go. That sounds plumb ridiculous to me.
Let me suggest something that may work.
Mr. President,
Each one of them turn into you what they think is the important issues and then go from there.
Very good.
Yes,
also, Mr. President, the board gave space to the director to search out what she would recommend. So are we wrong for giving her the opportunity to search, to do what she feels best for the
Not about
center?
right or wrong. We're just trying to reach consensus here. We've got way too much contention in this mental health agency. For the whole 4 years I've been here, we just had problems in it. So we need to resolve it. We need to help the citizens who have these needs. And it's not about us, it's not about you, it's not about me, it's about those people who have a need for these services. It's why the taxpayers of our parish pay those taxes.
Could you repeat that statement one more time? I want to make sure everybody can hear that.
I think everybody heard it, Mr. Butler.
Okay. Okay.
Thank you.
Yeah. Thank you. Have a great evening.
You too.
Ms. Cheryl Fontenot, do you want to talk on the needs assessment now?
Hello, good evening.
Good evening.
I have been involved with this mental health program since day one, since I took office, because I have the same passion that you guys have for those with mental health problems, especially our children, because we lose so many of them to all sorts of things, and lots of them end up in jail. And because they're not identified early enough, we know the school system is identifying some, but it goes beyond that. And I was instrumental in redoing the ordinance. Now, after lots of research, and I've got a ton of it, I brought it all with me so that everybody could see that I really have a package of stuff. After a lot of research, I found out a lot about mental health. And I found out that a board is definitely necessary all across the nation. I've got all the beginning of when mental health started, think it was in 1778. I have that information too. I have a thing here. It says, this is approved by the National Mental Health Association Board of Directors, March 11th, 2000, expires December 31st of 2005. So I'm assuming they have a new direction by now, but this is what they said. The rallying cry of nothing about us without us has heralded extensive involvement of consumers of mental health services, families affected by mental health illness, and families of young children with serious emotional disorders, together with other advocates in the improvement of the mental health system in the United States. It is the duty of government agencies, mental health providers, and advocates to accommodate and strengthen such stakeholders' participation at every level of public mental health system, and in this era of privatization and private sector providers of mental health services as well. Any system using public funds must be publicly accountable for assuring effective stakeholder participation. I also have with me the information on the state and how the state Board of Mental Health operates. The State Board of Health operates by a board of directors. Oversight by the Board of Directors provides accountability and responsiveness to local communities. Management and oversight are provided by a board of community volunteers recommended by the local parish government and appointed by the governor, representing each parish within the district. The structure provides greater accountability and responsiveness to the local communities. At the heart of the agency's design is the understanding that local control and accountability are the underlying reason for its services. Its unique management tools. Management and oversight are provided by a board selected from community volunteers, appointed by the governor, representing the parish within the district. The executive director is hired and reports to and is annually evaluated by the board of directors. That is how this mental health board was set up at its onset. Because our parish president had problems with that, I redid the ordinance and I made it more favorable to the parish president to give him a little more control over the director without removing complete control from the board. It is advisory to an extent, but the recommendations of the board are vital and very important according to all of this information about mental health. It is very important to the citizens and especially to the children that this be done this way. So when the board recommends to the parish president that they are having a problem, it's the parish president's duty to make sure that there's peace going on. It's the parish president's duty to direct the director, work with your board, give your board, listen to what your board is saying. Ultimately, he's got the final results. I know that things were reported to him in October of 04.
Correct.
Of
06.
06. October the 4th, I think, 06. I have that information, too. We didn't get any response.
Still haven't gotten one.
The board didn't get any response. They've had all sorts of problems. I know Ms. Hodnick was concerned about the counselors leaving because of the bonding that the children have with counselors and how important and detrimental to their recovery that bonding is, and that when you change a counselor out, the child has to start all over. Well, guess what? An adult has to start all over. We find it difficult when we have to get somebody new to deal with. So even more important are the children who don't know and don't know who to trust. And so that was a concern of ours, and we have asked. I've sat in meetings with the CAO and listened to some of the findings that was taking place, and yet here we are months and months and months later and still have not even got an answer for it. And the needs assessment has been done. We need to find out a way to how to get it implemented. I am very disappointed with the fact that we have lost grants over the years, especially those dealing with substance abuse, which is becoming more prevalent in our society today than it's ever been before. And we've got to get on top of some of these things. We've got to do something that can prevent, and we've got to work to make our children the best that this nation can have. I'm talking about the children in Ascension Parish, because most people don't realize that Ascension Parish is unique. Its citizens saw early on that we had a need. They passed a tax to address the issue, and it's important. It is very important that the people who have the passion and see the need supervise and direct the direction that the mental health program goes, because we, the taxpayers, are funding the bill in order to get the very best that we can for our young people. I thank you.
Thank you, Ms. Fondo.
Thank you, Ms. Fondo.
And next on our budget is to hear
On our agenda.
on my agenda, budget. Boy, I got budget on money on my mind right now, huh? Is
Presentation.
a presentation from Finn's Miss Lynn Hassenbach. Is that correct?
Ms. Lynn.
Miss Lynn
Not everybody knows me by Lynn. It's Hassan Bowler. Is how
Hassenbach. Right, yeah.
First,
It's nice to meet
thank
you.
all of y'all for the opportunity to be here and to talk about Fins and Task. It's something that I love to talk about because it's a great program, but sometimes we don't get the opportunity to talk to everybody that we would want to, so I appreciate y'all inviting us to come here. And just to tell you up front, if I stumble, if my voice shakes, I'm a nervous wreck about this being on TV, so just warning you there. Don't, just try to ignore that. We do have two programs. FINS is Families in Need of Services, and TASK is the Truancy Assessment and Service Center. Both programs are real similar. The process is similar, but we serve different clientele. FINS was started actually in 1994 by the Louisiana legislature, and they said that every court having juvenile jurisdiction had to establish a FINS program. So there are 41 FINS programs in the state, and they're all different. They set up pretty loose guidelines as to how to do it, and so everybody ended up doing it pretty differently. And in fact, ours covers Ascension, Assumption, and St. James parishes, and we're a little bit different in each of the three parishes that we serve. The TASK programs, I should have looked it up and I did not, so I'm not exactly sure what year, but it's been in recent years that they actually started. Last year was our first year to have a TASK program, last school year. And there are 17 TASK sites across the state, so every parish does not have a TASK site, and we're kind of one of the early ones. The FINS program works with children who are about 5 to 16 years old. We do serve some 17-year-olds, but generally 5 to 16 is our age range, and their families. We get referrals from the school system, from the court, from the sheriff's office, from the district attorney's office, from local service agencies, pretty much anybody, and parents will call and contact us and ask for assistance as well. The referrals that we get are for kids who are repeatedly violating school rules, ungovernable at home or in the community, running away, truant, basically status offenders, and that was developed because that's what was identified as things that lead to delinquency. It's pretty much a delinquency prevention, early intervention type program. TASK serves kindergarten through 5th grade, and we take kids who have 5 unexcused absences from August to December, or January or after if they have 10 unexcused absences, and all the referrals come through the school system for that program. Once we get a referral, The schools or whoever makes the referral, they send us some information about the client and anything that they have done to try to intervene already. And we have a risk indicator survey that the teacher fills out to tell us what they see, any concerns that they have that they're seeing, either related just to the child or even the family, chaotic family life, possible substance abuse, anything like that. We get copies of behavior reports, attendance, grades, all that kind of stuff. And we review that and screen it. And we put the kids into one of two categories, either high risk for continued problems or low risk. If they're identified as low risk, basically what we do is we send a letter to the family and say, your child was referred to us, this is why they were referred, this is the law and the school board policy on attendance, these are our concerns. We'll sometimes state in there any local service agencies if it looks like it may be a counseling issue or something. We may put that in there for referrals for them and let them know what we're going to do is monitor the child's behavior, attendance, and grades for the rest of the school year. But if no more problems occur, then they won't hear from us. If they want our services, or if the child continues to have problems, then we'll move them up to high risk. The high-risk families are the ones that we set up a meeting with. We sit down, we meet with the family, and depending on the age of the child, all FINS cases we meet with the child and the family. The task cases we really look at how old the child is and developmentally if they should participate or not. But we hold a meeting with them, we do an assessment, look at what all the needs are of the child and the whole family and how it impacts the problems that they're having, and develop what's called an informal family services plan agreement. And from then, we do case management and we follow the plan. We do motivational case management. A lot of the case manager's work is involved in trying to help the families understand how accessing services and participating in services will really help them in the long run. There's lots of barriers. I mean, y'all know about that in your needs assessment. Definitely address that quite a bit. The barriers to treatment and to people accessing treatment and wanting to access treatment. So we do a lot with that, trying to help parents understand, in particular, how it's helpful for them and their whole family, much less just their child, to be involved and to do things. We meet with children a minimum of 2 times a month, and that's a minimum. Generally, it's actually 3, 4, 5, 10, depending on what's going on that particular month. But the absolute minimum is twice a month. Absolute minimum to meet or talk with the parent is once a month. And all service providers. We regularly get their attendance, behavior, and grades at the school. The school counselors are in touch with us all the time, ISSP providers, all the mental health providers that are involved. We advocate for the family as needed. We'll go to IEP meetings. We'll go to any meetings that the child has with the school. We've been to mental health meetings before. Sometimes you have families who are just so nervous. And, they'll say, well, I've talked to you about this. I'm scared to talk to somebody else about it. Well, let me go, and we'll kind of hold their hand and work them into that and then wean ourselves out of that process. So we've done that. We don't do it a lot, but we've done that some. Did you have a question?
Yeah. I'm very familiar with FINS and TASC due to the fact that I was in the educational professional field for 7 years in Ascension Parish, and I'm very, very, very familiar with the program. I was an in-school suspension teacher, and all the forms you said, I had to actually get that from the assistant principal and turn it over to FINS, and I worked with FINS a lot. And my question to you is, how many of those kids that you all accumulate that is being seen, how do y'all work together with the mental health department?
Okay. Basically, I came up with numbers because I figured that would be a big part of what y'all really wanted to hear. So let me jump to that part. And this is as of 2 weeks ago, these actual numbers. We have a total of 382 clients right now, as of 2 weeks ago. About half of those are in the low-risk category and half are in the high risk. We have 192 in the high risk. Most of our referrals during the school year, 68% of them come January through May. So our numbers will double. Like if you had invited me to this meeting in March, the numbers would be even significantly more than they are right now. Right now we have 144 with active informal family service plan agreements. 48 we're still working on getting them to come in and sign the plans. But we have 144 with active plans, and of those 144, 76% of them have mental health or substance abuse services into their plan. 80% of that, 76%, so 80% of the ones that we have referred to mental health or substance abuse, 80% are active in treatment.
That's one of the questions I had, because I asked that question in our board meeting 2 months ago. What is the percentage in the Donaldsonville area with our children? And my director couldn't give me an answer, because we were trying to figure out what kind of what needs we need over there to get the building open more than what it is. And I don't want to get into that right now, but that's just one of the questions that I had, because the need is the need is with the children. And if Fins and Taz seeing all these kids, I mean, we're not getting nothing from our director. I mean, I don't even know if she can still go over there, but that's beyond my control. So, but
definitely beyond mine.
I ain't even gonna get into that. So I just wanted to make sure that we do have a lot of kids being seen over there.
Right, and well, and we're seeing them in, obviously in case management and doing the supportive, but we don't
With the
do
substance
psychotherapy.
abuse. Okay.
We don't do mental health, psychotherapy, counseling, that kind of stuff. We do the motivational case management. We do some educational counseling and supportive, and we do have contracts, and again, that depends on when I meet with you, which contracts I would say that we're doing, but we have anger management programs, often on parenting programs, social skills groups, kind of different things, recreational groups. But we do, and I didn't break it down between Donaldsonville and this side of the river.
It's not, but I just wanted the numbers, to see where I stood at.
76% total that
Right.
we have put mental health into their plan.
Okay.
Now, like I said, 80% of those are active right now in treatment. 20% are not, and we're working on getting them active, but they're not active yet. The ones that are active, I did break down where they go. 40% of them are with the Parish program, the Parish Mental Health or Substance Abuse program. 32% are with state. So that's Gonzales Mental Health or Donaldsonville Mental Health. 20% are with private providers. We do have some people who have insurance coverage for mental health or substance abuse services, and they prefer that. We can't dictate to them where to go, although we have preferences, because there are some people who are easier to work with than others. But if they, we can't tell them that. So 20% are with private providers. 7% are with the school-based mental health program in Donaldsonville. That's actually with the state, but I broke that out. And then 1%, and it's actually just one client, is with a psych rehab program that's in Iberville Parish. And they travel over there for that program.
Okay.
So that kind of gives you your numbers, if that
I would just want
answers the
to
big
commend you on
question.
that information, and I appreciate you coming. If you need me for anything regarding these children, anything, I don't care what it is, just feel free to give me a call.
Right.
I give you my number, my card, or whatever. I go beyond and beyond for a child. I'm sorry. I mean, that's just me. And I'm sure the board feel the same way. So if you need anything, I'm here.
Great. Thank you.
We do.
Lynn, were those numbers strictly for task, or was that
That's
Fins
task
also?
and Fins
Task
together.
and Fins together.
Combined. Mhm.
And would there be any value in trying to coordinate services with the mental health clinic, like the types of groups that you were talking about that you all do? I know your resources are very, very limited.
Extremely.
Would there be benefit in trying to do that?
Definitely, definitely. And we have done that over the years, and there are different times. If there is a program out there that will provide a service that we need for our child, we're going to use that program first before we use our limited resources. So, when there have been anger management groups to refer to that the parish has provided, we've done that. We don't do any substance abuse groups because they offer all of that. Right now, the school is providing a parenting program that we refer a lot of our parents to. So if somebody else is providing it, we definitely, and I love working
You need
with
other people to
Yes.
provide it, huh?
Yes.
Well, and if we can maybe build some of that into a strategic plan where we are really thoughtful about coordinating resources and making sure that the needs of the families you're serving are taken care of through the program. We certainly could do that. That'd be a better use of resources.
That actually it would. It really would. And I tell you, a lot of people like OID, people who come to the court system with ideas for programs and grants and different things. Ms. Fontenot several years ago did the same thing. Often the court will refer to us, or somebody will contact us looking for referrals, because we're the ones who see
Right.
all these kids. We
Right.
kind of have the referral base for all this, so I will never say no.
Ms. Land, scenario, we have a first grade student. Tell me what else can happen. They are disrupting the class. They're seeing mental health. They're sent to ISSP more than in class.
Right.
What can happen to this child?
Well, gosh, that's such a loaded question, because there's so many different paths
we
it
can
could take.
discuss
but-
it later if, if it's not something that you can just...
Well, it's, obviously we would need to get involved and find out everything that's going on, because often, especially when you're talking about a first grader, it's not just the child. There may be something else going on within the family system that needs to be addressed, and maybe the child's in mental health, but maybe mom needs some services, or dad needs substance abuse, or the uncle who lives in the home, or whatever. So we would need to figure out what all is going on, and get every service need addressed. If the problems continue, and then the school has the positive behavior supports that they're working on now, that they're putting in place. There's a lot of new programs within the school system that's going on. If we've done everything and absolutely nothing works, and I mean, we've been down every road there is, we can go to the district attorney, and we do this on occasion, go to the district attorney, request a petition for the family to be brought into court. We explain to the judge what's going on, and the judge can consider removing the child from the parent's custody if that looks like it's necessary. They're pretty slow to do that, and they need to be slow to do that. There's not a lot of places out there, and that's not necessarily the best thing to do. But that is kind of a final option if nothing works.
Thank you so much.
Okay.
Thank you.
Any other questions?
That's it.
All right. Thank you.
I'm sure we're going to be getting a hold to you and talking some more, because I'm very interested in what you told us tonight.
Wonderful. Wonderful.
Thank
I'm
you for
happy
coming.
to come back or meet with
Thank you,
y'all whenever.
Donna.
Thank you.
Thank you.
Okay, we're going to have the state report. Mr. Ryan.
Good evening.
Good evening.
How y'all doing tonight?
We missed you.
Yeah, I've been here in a while. So nice to see your bright, shining faces.
Same here.
I passed out your statistics, so if you have any questions on those, I'll be happy to answer them. If not, I have a few other things I want to discuss.
Should be in the packet.
It should be in your packet. Okay. Okay. If you don't have any questions, that's fine. I just wanted to go over a few things. Today we had a health screening for all our clients. So we were screening blood pressure, blood sugar, risk factors for diabetes, because as you may or may not know, diabetes is a big risk factor, especially for people who are on psychotropic medications. And so one of the pharmaceutical companies provided health screening. So we promoted this with our clients and allowed any of our clients to come in and get free screenings, which we will discuss with them at a later date once we get those findings back. So I wanted to let everyone know that. As Brandy reported at last month's meeting, we're currently in the process of restructuring our services, and so we're looking at providing more group therapies. And so we recently hired a social worker who has extensive has been in inpatient substance abuse facilities where they do groups, and so we're anxious to be using his skills to increase the number of groups that we provide to clients both here in Gonzales and in Donaldsonville. And we are in the process of hiring one more social worker who will be in charge of our co-occurring program, which we're looking into. About 50 to 60% of our clients also have a substance abuse issue, which many of them we refer to the parish. But some of those clients decide for whatever reason that they don't want to seek substance abuse services. Maybe it's the stigma, maybe they just want to be treated in one place. And so we are looking at providing more groups and providing more services for those people as well, both here and in Donaldsonville. So, good. Any questions for me this month, since you haven't seen me in a while?
Is that all you need is one more, Counselor?
Is that all we need?
Yes, we'll call. I'll
take
make
as
a
many as
personal
you'll
call
give us.
to your boss and ask her to give you whatever you need.
Thank you very much. I'd be happy to take as many as you want to give me. Anything else?
Get that waiting
you.
list.
Thank you.
That's exactly
Thank you.
Which it is a little lower this month. So if you look at that, it's down from 50. I think it was 50 last month. Now it's at 36. So we're working on that. We're trying. All right.
Thank you. Okay. Next, we have some speakers. Brad Levine on personnel.
Good evening, Board.
Good evening, Mr. Brad.
Chairwoman Gotro. How
Good
you
evening.
doing tonight?
We're good. How are you?
Oh, I'm doing fine. I'm sorry that the parish president left. I had a couple of things I wanted to ask him up here. He was speaking on the suicide, drug, and alcohol abuse, about increasing the services for it and all that. And I just wanted to know if he knew that if somebody came in off the street with an emergency, that they were turned away and they weren't treated. I wanted to make that point to him. And also, get a couple things out of the way here. Let me just go ahead and start. I stand before you tonight to let the truth be known to the people of Ascension Parish and the misconduct of the director and the covering up of issues by the parish president. First, I would like to know is how long are they going to let this go on with harassing experienced, tenured employees in the agency? It was brought to my attention, and I want him to know this as well, is that OCS canceled their contract with mental health. These are the children that he was talking about that needed the services in Ascension Parish because of the outrageously high turnover with counselors in the mental health agency. I want to ask Mr. Ronnie Hughes, the parish president of Ascension Parish, to take the politics out of mental health so that people can get services that they deserve. A week and a half ago, the secretary resigned for the ruthless tactics and misconduct of the director and the careless attitude of the present administration. We received a rebuttal to the grievance in which she filed, and it was full of pathetic statements of the secretary's personal life and lies of her performance. Mr. Hughes made the statement to me and the secretary as well that Susan is just not a people person and that she needs help in that aspect of the job. Well, Mr. President, this is the most important aspect of the job, is being a people person, because you are serving the people of Ascension Parish. You know, I do understand that Susan has the credentials for the job. She is very highly educated. I will give her that. It's continuously thrown in my face by the parish president. Well, you know, take a look at the track record. Take a look at the turnover in the employees in mental health. Take a look of the services that have been cut in mental health. And the credentials mean nothing if she cannot serve the people. She stated numerous times of policy violations on the secretary. Well, I have attended many schools from management. I've been in management for about 12 years now. And it's always said, all the classes that I've ever attended, it said that management is leader-led. Let's begin on the policy violations. Right here before me, I have a campaign finance report for Tommy Martinez, who's running for parish president of Ascension Parish. A $500 contribution was made by the director of mental health. Section C, page 50 of the Ascension Parish Policy and Procedure Manual, it says that no employee shall show any partisan to political activity. Page 48, Section C of the Policy Procedure Manual, it states that no employee shall either directly or indirectly pay, render, or give any money or services or other valuable things to any person for or on account of employment. The Director of Mental Health, Susan Middendorf, has never made a campaign contribution to any parish president in Ascension Parish. I have here a copy of the Secretary's rebuttal from Susan to a grievance, which states nothing but of her poor performance and rudeness towards clients, and how she has no right to question her authority and the wrongdoings of other employees. The fact is that Susan has been questioned on her misconduct and horrible behavior, that she had to put these lies of her performance. Board members, I have 4 performance appraisals that were done on Michelle Levine in the last year and a half. Relationships with people. She's very pleasant with staff and clients. Work habits and dependability. She's very punctual and can be depended upon. Quantity of work. Completes assigned duties quickly. Accepts supervision direction. Does accept supervisor's direction. Initiative. She does take initiative and is very flexible. This was done on 7/3 of '07. She was written up while she was on family medical leave, which I brought to you last month. Because she's not pleasant with staff and clients. She doesn't take the whole rebuttal to the grievance states that she was a substandard employee. She doesn't take initiative from management. This is an outright lie. It's an outright lie. The entire rebuttal to this grievance is a lie. She fired 20-plus employees over the last year and a half. I have 2 of them that are sitting back here, with 3 of them actually, if you include the secretary.
Mr. Brad, I don't mean to cut you off.
It's the 3 minutes.
3 minutes. Yeah. Oh, go ahead.
I'll wrap it up.
Okay, thank you.
Another thing, it is Michelle's business on what Susan does, and everyone is doing, because she's a resident of Ascension Parish, unlike the mental health director, and a taxpayer, and this is a taxpayer service that she is so rudely disarranged. Board, I want to tell you on a job that's well done by you 5. You have the heart to serve people, and that's what this is all about. It's about people. I ask you once more, after this recommendation has already been made, to relieve her of her duties and terminate her on account of her violations and ethic laws, state laws, and violation of the policy procedure manual, and go according to the home rule charter, turn it over to the council for emergency 2/3 vote to terminate her service. Thank you for your time.
Thank you, Ms. Levine.
Thank you, Mr. Levine.
Miss Rachel?
Hello. My name is Rachel Hathorne. I came into this totally unprepared this afternoon. I really don't know what the agenda is supposed to be. I do want to take the opportunity and the time to make a few remarks, and I, too, deeply regret that Ronnie Hughes took himself away from this meeting, because the part that he needed to hear is happening now. He mentioned when the people who had been former employees were asked to come and give some information to, I believe he called him the CAO, Mr. Moore, I think his name is. Is that correct? Moose Moore?
Pete.
Mr. Pierce.
Okay. I was one of those people who were called. I was told that I was being asked to come to speak to Ronnie Hughes. When I got there, Ronnie Hughes was not there. It was his secretary and Mr. Moose Pierce. I emphatically told both of them that I did not want to talk to them. I didn't come there to talk to them. I wasn't asked to come to talk to them. I wanted to talk to Ronnie Hughes, and that I would only talk to Ronnie Hughes. Well, after considerable coaxing and cajoling and being promised faithfully that what I said would go to him, I finally agreed to sit down and have a conversation on the strength that I would then later have the opportunity to say to Ron Hughes what I wanted to say. Yes, I could do that. So we had the conversation. That was on a Wednesday. An appointment was set up in that meeting with him, for myself and Ronnie Hughes for Friday morning for 8 a.m. I went back to the office for that meeting. Walked in. You never saw such surprised people in all your life. What are you doing here? I have an appointment with Mr. Hughes. Oh, we don't know anything about that. We don't know anything about that. When that was the last thing that was said when I walked out the room. To this day, I still have not been able to get an appointment with him. Now, other things that have been talked about today, let me put some input into that.
You have 1 minute left, Miss.
All right. There have been a lot of people turning over from the agency at Ascension Counseling. I was one of them. I did not want to leave that agency. I would not have left that agency if I felt I had any choice. I walked away from a retirement that I desperately needed, 4 years short of it. Would not have done it if I didn't feel I needed to.
My God.
I left there. Yes, I got more money when I left, but that's not why I left. And I think that's true of some other people. They got more money when they left, but that's not why they left. I left there and became a program director of a partial hospital program.
Yes, indeed.
For the dually diagnosed that Mr. Ryan was speaking about. My heart is with the youth of this parish, and that's where I was working. I really regret that I'm not still there, and I thank you for having some open forum where some things could be said. I would like that opportunity to speak to Ronnie Hughes face to face. My contention was, I don't want him to be able to say that nobody ever told him. I want to tell him. Thank you.
Thank you.
Thank you.
Christina?
Hi, my name's Christy Massendale. I used to work with I used to work with Parish of Ascension also as a counselor. Honestly, I've had concerns about Susan since February of 2005, being the director of the clinic. I wrote a letter to my supervisor, Stacy, at that time, on February the 21st. On February the 22nd, I was called into Susan's office for a meeting where she challenged my attitude, my behavior, my hostileness, something I had never demonstrated to her, but obviously my letter and probably some word of mouth in the office she approached me about. At that point, she and I had a disagreement. I believe we probably both raised our voices and some things got out of hand. She threatened to fire me at that point, said that if she had something on me at that time, I would be gone, that I really needed to think about whether I wanted to work there or not. So from that point on, I really felt like my job was threatened. I continued to do my job. Things continued. They got a little bit better. I wrote some complaints to HR. They came in, they did some investigations. I really don't think it did any good. Then I went above that and I wrote an email to Ronnie Hughes. I don't think much came of that except that I angered the other folks because I went above their heads, and that's pretty much the message that I got. Susan had come back and said, you know, jokingly, what did you think was going to happen? You were going to get me fired. Actually, I was hoping that would be the outcome because I really didn't think she was doing a good job. Initially, I was very pleased. She was smart, intelligent, well-dressed, you know, came over really, really good and powerful. She made it clear from the beginning that she was a bean counter. And I think I can refer to some things Cheryl said, Brad said, Rachel said. I've got some things to support all of this. My opinion is that she tends to use her personal opinions and then make professional judgments regarding her personal opinions on staff. some of the things that has happened. She has talked about other co-workers while they weren't in the room and badmouthed them. An example of this, and I hate for Michelle to hear things like this, but one of the things she said during a meeting was that Michelle is not one of our strongest employees, and made that clear that she was not that bright. And she did that in front of the rest of the clinical staff when Michelle wasn't present in the room. My opinion is that she did everything she could to staff split. She showed partial treatment to the clerical team and was very hard on the clinicians. And as a licensed clinical social worker, I really expected much more from her. And I was really surprised at her ethics as far as working with her staff, because I think what she did was tore down everything that made that clinic what we wanted to be there for. That is the worst pay I've ever made since I've graduated with my bachelor's degree. But because I liked it so much, I liked what I did, everything was working until Susan came. She took away everything that made the job good for us. And again, I can reiterate their sentiment. When she is challenged, she retaliates. And she will find things to start keeping track to get you out. When I was fired, she made a list of things, and the funny thing is the date started on February 22nd. So she started keeping track of my absences, even though I'm sure I filled out time slips. There were things like I went to a district attorney's meeting. I'm sure I had approval to do those things, but yet they were all cited as reasons for my termination. I know the reason I was terminated, and that was because I challenged her, and I was not going to be treated like a child or disrespected by my boss. And I had some support from people, but I really think people were afraid to lose their jobs, so they didn't want to speak out. Regarding the turnover, if you review any of the letters that Stacey Moreau's got from me, I cited this turnover. I said, this is just the beginning. As long as she stays as the director, you're going to keep losing your good staff. And that's exactly what's happened from what I've heard. There's probably no one left there when us folks were working together. And it's a shame, because you had a good team that worked together and enjoyed working together. And for whatever reasons, she tore that apart from us. And that hurt the children. One of my concerns, too, was most of the things she cited on me were time. You know, I was late or I didn't show up. I was a victim of domestic violence, and I had numerous court hearings, and my understanding was I had support for that. Obviously, I didn't, even coming from a social worker. Another concern I had was when I was dismissed, I had no time to do closure with the clients, and that's a significant part of discharge planning. And even when to me, it's discharge planning. If I'm terminated, you know, I still need time to tell these children that I'm leaving. I had no opportunity to do that. I had a few cases that were crisis cases, and I was seeing these children at least once a week. My concern was that they were not going to get seen after I left. And I don't know that. The only way to look at that is to look up my client list and to see if these clients were seen after my departure.
Could you wrap it up for us, please?
Okay. I did see a couple of parents, and parents told me that their children were not seen in a timely fashion after I left. Privacy, no respect for privacy. One of my coworkers got an email announcing that I had filed a complaint against her. Again, just more areas where she was showing that she was trying to break up her clinic and her team, and I really don't understand that. One more point that I wanted to make was we were told that we needed to do 60-minute sessions. We needed to do our sessions, we needed to do our paperwork, our wrap-up, and everything within 60 minutes. Now, this is after she's taken a lot of time from us. When we challenged that, she said, well, you know what, see them in 30 minutes and get them out. Because it was all about getting the clients in and getting them out, and it was not about patient care. And I want to say I appreciate you guys letting me speak. Thank you. I think I may have been heard this time.
Thank you.
Thank you. I just want to comment on all of you. I appreciate that you're coming, and we did our further actions, let you know that we filed for investigation, this, that, and the other. It's beyond our control. We did what we had to do. We made motions. We voted. Ain't nothing else we can do. And I want to say that statement for the citizens of Ascension Parish. If you're listening and tuning in and watching, We followed the proper procedure, the proper channel in handling this matter, and if the rest of the board want to comment on it, they can.
Madam Chairman, I would just like to say my compassion goes out to you all, and I'm grateful that you came and made us aware of this, some of the things we are already aware of. But if you could possibly stay for the council meeting tonight, it's been requested that results from the investigation, they report tonight. So if you can stay for the council meeting, we are all anxiously waiting to see what's going to happen. You all may be aware of, or you may not be aware of, that we had made a recommendation to the parish president for the removal of our director. And I made this statement to the parish president that anybody that has a job, I feel, wants their job. So when I made the recommendation for her removal from the mental health board, I suggested to the parish president that maybe he could employ her in his office. So if you can stay tonight, please do so. And thank you for coming again.
Moving on, now we have the status report from the Ascension Parish Mental Health. Ms. Susan.
Thank you. On our clinic statistics, I'd like to point out that we actually had 1,338 appointments scheduled. That's a very high number, probably our highest ever, and that we saw 1,014 people with a rate of 76%. We're very pleased about that. That's 424 more than October of last year and 379 appointments more than October of last year. We screened 147 calls during the month, and you have the specifics on the breakdown of the appointments. In Donaldsonville, we provided 10 orientation appointments, 5 intake appointments, 10 individual. Then there were 4 groups with a total of 20 people attending the 4 groups. Under clinic collections, we collected $12,301 this month, October. That compares with $6,428 collected in October of '06 and $3,331 October of '05. Under personnel, our receptionist did resign on November 5th. She has been replaced temporarily by a Lofton, the same young woman who was sent to us by Lofton through Human Resources. She's doing very, very well. She's learned the job quickly and is just doing an excellent job. And I have asked HR to hire her permanently. I haven't heard back yet, but I made the request, so I wanted to let you know that. She's fully trained and able to do all aspects of the position, and we're able to give her several more complex duties to perform, so she's been a real asset. Under financial, tech staff has asked that we integrate our agency's computer with the computer system of the parish. We'd like to do that. I think that's a good recommendation. And it's going to cost between $2,500 and $5,000. They couldn't give us an exact estimate at this point. I'd like your approval to go ahead with this. We think this is going to be a lot safer. We'll have fewer problems with our system going down, and all of our patient information will be protected very carefully on the server.
It's not more likely that it can be hacked into when you go on to...
No, these people are specialists in that, and there's very good technology for protecting it. I don't...
Okay, well, that's the only thing I was worried about is if it's mixed in with the parishes.
No, all of our client data is password protected, and it's going to be in a different place. And
a different place.
Yeah, okay. So people can't just access that.
So do we need to make a recommendation?
So I'd like a motion, please, to approve $2,500 to $5,000, depending how much they need to actually complete this project.
Okay. I'll make a motion that we approve the funds needed to complete the project of integrating the agency's computer system with the parish system.
We get a second? No second, it fails for the lack of a second.
Approval of psychiatrist contract. Our psychiatrists have contracts that are annually renewed every November. They end at the end of December. A new contract is effective the 1st of January. And you have had contracts to review. Please note that the total amount on this year's contract includes an increase in the hourly rate from $160 an hour to $175 an hour. And that's been budgeted for. That was in the budget that you approved. And the same for Dr. Bourne's. So Dr. Scheck-Snyder's contract is $165,000 and Dr. Bourne's is $88,000.
Do I have a motion to?
Chairman, go to our motion that we approve the psychiatrist contracts, Dr. Scheck-Snyder and Dr. Barnes.
I second that motion.
Cherry? Yes. Motion passed.
Thank you. Under grants, there's no report under Governor Safe and Drug Free. Those are our Strengthening Families groups, which are operating. We're very pleased. They're operating at the Donaldsonville Clinic. Under Capital Areas Prevention Grant, we did receive the additional grant for $40,000. We designed a new program, and we're in the process of beginning that program. We'll have it up and running by the first of the year.
Okay, that's 2008, not 2007.
2008, uh-huh.
Okay, we got
it was approved, and then now we have approval to go ahead and set it up. And we're going to use staff that we already have, so we don't have to hire any additional staff for this. In the spring, when we have to do a new proposal, we're going to rethink the way we're providing our prevention services and integrate that and ask for.
And some of that is going to be performed in Donaldsonville, some of this grant.
Yes, we talked about that last month. It's going to be a group at Donaldsonville High School for middle school students, and it's a group at the alternative school for the option students. Under capital area treatment, we're operating our new intensive outpatient program. So far, things are going well. So I don't have any report there. And under the Ascension Hospital Services Board, they have sent out a letter asking anybody who's interested in requesting the funds for them to come to their meeting on November Tuesday of next week. I think that's the 20th. I'd like to go to that, and I have a proposal to present to you, a second proposal. So I'm going to do that, and then...
do we have a copy of that proposal?
It's the pink paper in your folder.
Paper. Okay.
And I apologize that I'm getting it to you now. I just put the finishing touches on it at 4 o'clock this afternoon. I actually took some vacation, and so everything is running behind this month. And I'm sorry I didn't have my thoughts more together last month when you asked me, but there's a great deal of material in the needs assessment, and coming up with a proposal takes a lot of time and thought and effort. So let me briefly run through the proposal, and then you can ask me questions.
Excuse me, hand me my package over there.
We are asking the hospital board for $304,000 over 2 years, $171,000 the first year and $133,000 the second year. In reading the needs assessment and listening to the consultant's presentation some time back, the three priorities that struck me most forcefully was the request for timeliness of service, for increased access to services, and questions that were raised by some of the consumers about the quality of the service. So I think those are all important things to address, and as President Hughes said, we need to assign priorities. These are the main ones that I've picked out. There are other things that I think we need to address, but these seem to me to be the most important to look at initially. So this is sort of step one. I hope to bring you something every month, if not next month, certainly in January, something in addition to this. What I'm asking to do is that we address the concern of timeliness by adding 2 staff members. One would be a full-time mental health counselor, master's level. One would be a bachelor's level intake worker / case manager. And what we would do is have the intake worker available to see people who walk in, since you all said you wanted us to do that, and who could handle some of the telephone intake with the support of the staff, and perhaps occasionally do an intake. The problem we run into is that we don't want intakes done by anybody but the person who's going to see the client, because that all has to be repeated when the person sees their therapist. So it's not good management to have your intake worker be doing the full set of intakes, but they can do a crisis intervention and an initial contact. So that would address timeliness. Access overlaps a little bit with timeliness. You all expressed a concern for crisis intervention services, and we are certainly not available at night, on weekends and holidays. The staff, we work regular business hours. So what we'd like to do is contract with the Baton Rouge Crisis Intervention Center to customize a service delivered by telephone, and they have a hotline, a crisis line that's toll-free, and for a contract fee they will customize a response to the clients, and we'll make referrals for them after hours, at night, and on weekends and holidays. So we were asking for funding of a contract that I estimated to be about $15,000 to $20,000 a year.
Something about that, or did
Sure.
you want to finish? When you said they customize a response and make referrals, does that mean they would actually provide some crisis counseling by phone?
No. Well, I don't think so. They do de-escalate the caller. They don't just say go here and hang up. They de-escalate them. They do. You're familiar with their services.
Yeah, and I guess I was thinking that they do a little bit of crisis.
They help them de-escalate. They troubleshoot, problem solve with them, and then they refer them based on their assessment of the situation.
Okay, so you are talking about a little bit of a service there, not just a customized response to go
right. That's what I meant by customized response. We can work out, and I've talked to Sue Kenyon, and I'm going to talk to her again in about 2 weeks, and if you all approve this, and we'll flesh that out more. They can provide anything from a face-to-face assessment for about $75,000 a year to as what I'm calling this customized telephone assessment and referral service. So that would be my choice. I really, I think $75,000 is pretty steep.
Yeah. I just wanted to clarify exactly what that would involve.
Right. And then under quality of services, I would very much like to have our agency accredited by the Commission on Accreditation of Rehabilitation Facilities. That's called CARF in the business. There are several agencies that accredit service provider agencies. I think OCS use the Council on Accreditation. Hospitals use the Joint Commission. The managed care companies use NCQA. I'm very familiar with all of these. I've worked at different times on accreditation for all except COA. And for our services, I think CARF is the most effective. Now, accreditation means that we hire a consultant to come in and look at everything we do, every service we provide, every management structure, all our financial structures, everything. And they make recommendations. They make a lot of recommendations, and we spend almost 2 years working with the consultant to come up to the CARF standard. And then we apply for accreditation, and they have a site visit, usually lasts 2 to 3 days. The actual accreditation costs about $10,000. That's the fee. That pays for your site visit. The exact fee depends on how complex your operation is and how many locations. And since we have 2 locations, it would cost more than if we just had 1. Now, what I'm asking for also is that the hospital board pay for the consultant, and we would use Dr. Mark Viator, who's an expert in this area and who's worked with us for years very effectively. And they charge $30,000 for the 2-year process, and it's a comprehensive service. So that's what I'd like to ask the hospital board for. Now, they have a great...
Could you get us some information about that accreditation
the process? Sure. Yeah. And the other thing I want to point out to you about accreditation is that Medicaid is now requiring CARF accreditation or JCO, but you know, we're not a hospital. The Medicaid program ban, or moratorium is the correct word, on mental health clinics is going to expire in 2008. I don't have a crystal ball to know whether or not it's going to be reinstituted or whether or not we'll be eligible for Medicaid reimbursement. But we can't support our agency solely on grants. We need to have another funding stream. And I'm very, very interested in receiving Medicaid payments. And I'd like to be set up and ready to go the minute assuming they lift the moratorium. The other thing is that Capital Area is one of our big contractors, and they're in the process of JCO accreditation because they have a medical model service program, and I'm guessing that pretty soon they're going to require their vendors to be accredited. So I think it's very important. It's a long process, so Brenda knows a great deal about it because she's been through it very recently. So that's my proposal. I attached a proposed budget for year 1 and year 2. Mrs. Stafford didn't say anything about year 3, so I'm assuming that it's only going to be the 2 years. I'd like to have your permission or approval to present this to the hospital board. I know you haven't had a chance to read it, and you certainly can call me between now and Tuesday, you know, to make any additions or changes.
I guess what I would just say is that as I've looked through the needs assessment and tried to pick out some of the areas that I thought were really critical that we start working on, that is one, the accessible and timely services. And so this certainly does address that. I wondered if perhaps something like the medical after-hour clinic sort of model, where they have people available on non-traditional hours.
You mean sort of a dock in a box kind of thing? You know, where you
No, I don't mean that.
No, I mean a walk-in clinic.
I meant some opportunity for people to access services other than in traditional hours is really what I meant. So perhaps a different level of service,
I think that's
longer
an excellent
hours.
idea. We've looked at hiring contract staff for the evening.
Yeah.
We have excellent security staff. We can't have any program open without security at any time.
I'm certainly not talking about
idea.
any less quality staff,
Right.
but I'm talking about meeting the needs of people who have difficulty accessing services Monday through Friday, 8 to 5.
Well, our mental health counselors are there until 6. Our substance abuse counselors are there until 8. So we do, make an effort to accommodate as many as possible. The other thing I've looked at, and I'm very interested in doing, is Saturday services.
Okay, great. And I think as much
as I'm a
as
child therapist, I'd much rather see a child on Saturday morning than at 6 o'clock in the evening after a school day.
So I think as much as we can
but all that would
meet
have
those
to be
goals,
contract staff.
Certainly think that
Would
those
you like
are
me
goals.
to add contract staff? I can add it. All I can say is no. Would you like me to add that?
Yes, ma'am.
Well, I'd like to add whatever's necessary to look at extending some
Good.
hours, having hours that would be more accommodating to the
Our
people.
staff is completely maxed right now.
That's fine,
Completely.
whatever.
We're doing more with less now than we've ever done before. They're not complaining yet, but they will shortly.
Well, that's fine.
So,
The only, there were two other, do you want
Go
me
right
to wait
ahead.
for that?
No,
Or
ma'am.
just
Go right
two
ahead.
other pieces as we're talking about that, and I don't know if either one would fit into this proposal or not, but one other thing that clearly stood out to me was the need for a public education campaign. That has come up over and over again, and it was
Now, the
clear.
hospital board will not pay for that, but we can certainly do that through our board and perhaps through a small grant. I'll be glad to look at that.
Okay.
I think that's very important.
I did notice that one of the, I see you looked at the different grants that had been recommended, and one of them, although it does not fund direct services, it may fund an advocacy program
For tobacco.
or some type of public education kind of campaign.
For tobacco only. The two tobacco advocacy grants. Is that the foundation grants you're looking at?
No, I'm talking about integrated pilot test demonstration. It doesn't say anything specifically
What's the
about
agency?
The Edelson.
Edelson. I don't believe we're eligible for Edelson. I think they require you be a 501c3. I'll double check that, but I'll look into it.
Okay, I didn't see
Yeah.
that on this
Yeah.
report out, but it does say that it does support advocacy type programs. And so if we looked at some type of public education campaign, maybe on 3 different levels, one where we're talking about some real primary prevention kinds of things. I happened to look at one motto that talked about it as more of a guide to mental wellness, and so kind of approaching it from that perspective. Another area in a public education campaign might be around reducing the stigma associated with treatment for mental illness, and then finally something on accessing services, because I believe the needs assessment showed that a great number of people were not aware of the actual services that we do have already available. So if we had some type of public education campaign that addressed those 3 areas, that the accessible and timely services, and then wrapping this all into some type of strategic plan for the agency that really allowed us to prioritize where we're going as an agency, set benchmarks,
And that'll come out certainly out of the accreditation process, because that's setting benchmarks and comparing them with national standards is a very big part of the accreditation process. And the consultants that I'd like to use work all over the country, mostly not in Louisiana. And so that'll be very helpful in establishing these benchmarks and assisting us in meeting them, which we certainly plan to do.
Great, yeah, I think that would go a long way in that. And then finally, the other thing is that I think as part of that strategic plan, we really need to work around stabilizing staff, reducing turnover, and creating a real collaborative and cooperative working agreement.
And I think, I need to say again and again, salary is very important. My staff is,
Well-
my best people are already applying for other jobs because they, money matters to people.
Well, I think money is important, but we also heard that money's not everything, and so I think we need to make sure that conditions.
We're talking about paying top clinicians $40,000. That's so far below any standard, acceptable standard. It's just really
except working for child welfare.
Well,
and we all know that people who go into the social work profession typically do not do it.
I think they'd like to
for the
pay
money.
their bills.
They do want to pay their bills. I agree, but
I appreciate that. Is there anything else you would like on this?
There's only one other thing, Susan, and I know our time is running short. I see the next ones are coming in, and that is that it's all around town that this board tried to cancel a contract. This board only put a thing on the DA's invoices until we could get some information on how many children we're seeing. Because if we're only seeing 4 children in that program and we're spending $42,000, that's $10,500 per child. We want some input from you about how many children we're seeing and if it's worth the amount of money that's going into that program. If not, we will look at something else. But we did not intend any kind of way for the word to get out that we were trying to cancel the contract.
Well, Mrs. Gautreaux, people watch this program, so you need to talk to them. I'm not responsible for that.
Well, now the motion was made, and I listened to it today on the thing, and I don't want to get in any fight. This board did not try to cancel any contract. I misquoted Ms. Z's motion. And that
Celeste,
one
would you
word.
like to read the? Celeste has the transcribed information.
Miss Susan, I can hear and I listened to it today, and all I'm trying to tell the council and everybody else, this board did not intend for this to get around town, that we were trying to cancel a contract between the parish government and the DA's office. All we were asking to do is to get some information on this invoice that we approve every month. And that is public knowledge.
Right.
Anybody can come in and ask for how many people you're seeing. So this board asking for it is not.
We saw, according to the figures that Celeste got for us, 34 people in the juvenile drug diversion program in 2006. I can't give you a figure in 2007 yet.
Well,
So,
thank you. You see, that was easy to settle a matter.
We just.
Oh yeah, you told us you didn't keep those kind of
Well,
statistics.
I don't have it. It's in the software.
Madam Chairman.
Yeah.
And
Madam
about
Chairman.
FIN's referrals, we don't keep those statistics. We don't
Wait,
keep it by referral
please.
source.
We need a motion now to pass the DA's October
Wait a minute,
invoice.
I'm not finished with my report.
Oh, I'm
please.
sorry.
And
The last thing I wanted to tell you is that the sewer line backed up on our staff bathrooms again. This is the very expensive plumbing bill that we had in 2005.
I'm sorry. I didn't pay attention.
Okay. I just wanted to tell you that the sewer line for the staff bathrooms has backed up again. We had to have it cleaned again, so there's going to be another expensive plumbing bill. And we now have to do this every year to prevent these problems. So we've been without staff bathrooms for a week, so that it's all fixed. So, is there anything else on my report that you'd like to ask questions about?
I don't have anything.
Thank you.
Okay. Somebody make a motion to pay the DA's October bill?
Madam Chairman, I motion that we pay the October DA's bill.
I second.
I vote yes, so it passes.
Also, Madam Chairman, I'd just like to make the statement that I talked to Attorney Jeff Diaz today on the issue of the DA's drug diversion invoice. There was a mix-up. We thought that the Ascension Parish was paying the bill and the Ascension Parish Mental Health Department was paying the bill. That was the motion that I made, that we not pay the bill until we find out how it's supposed to go, because if two parties are paying it. So when I talked to the attorney today, he said he would look into it right away.
Thank you.
Thank you. I'd like to motion that we adjourn. And place the remaining items on our next month agenda.
Thank you all.